everybody. It's so nice to see you all. My name is Vanessa Merker. I am a health services researcher, so not a clinician, but a researcher who works at the Mass General Hospital NF Clinic in Boston. I do a lot of research on different parts of NF1, NF2, and schwannomatosis, but I wanted to talk to you today about what we're calling observational research, so observations. This is basically everything that is not an intervention. We're not assigning you to an intervention, but still we have lots to learn. And so we wanted to give some examples of what this kind of research is, why it's so helpful to us when you guys participate in it, and how it even informs back to clinical trials, how this all contributes to our larger goal of coming up with new and better treatments for NF. So I wanted to put this up. This is actually from the NIH, just kind of what's the difference between what we just heard about, interventional clinical trials and observational studies. So in clinical trials, the main thing we're doing, we are assigning you to get a specific intervention. So we, as the researchers and doctors, will be saying, you're taking this new drug or this new medicine. With observational studies, we're not assigning you to take something, but we're going to watch and see what happens. And you could be taking medication, sort of the every day-to-day medication your doctors prescribe. That's okay. It doesn't mean that observational studies means you get no treatment at all. It just means we as the researchers didn't tell you to start taking it. We didn't say, you've signed up, now you get drug X. You are just taking whatever your doctor would normally prescribe for you and kind of doing the things in your normal day-to-day life, and we're watching to see what happens. And why is this kind of research important? We can find out so much good information about NF. There's so much we've learned, but still so much to learn about how often are certain symptoms occurring. When are they going to develop in people? That's a huge question. We know there's so many variable symptoms, and we still haven't done a great job about predicting who is going to get what symptom and when. What is the likelihood? So trying to do these research to figure that out. We also want to try to look at risk factors. Are there things that you could be doing that are making it more or less likely to get a certain symptom or a symptom tuner? And really just to help us understand what matters to you and what are your preferences. And I wanted to tie this into an effort that the Food and Drug Administration has been running called patient-focused drug development. So even though the studies I'm talking are not clinical trials to test drugs, they're really important for informing the drug development process and making sure that patients' experiences and perspectives and needs and priorities are really thoughtfully considered in the drug development process. And this is from the FDA, and this is their commitment to really incorporating what patients and families want from the beginning of this research, so early on figuring out what impacts of the disease matter to people. How is the best way for us to measure that? So we know that when we're developing treatments, it's actually going to affect your day-to-day life. How can we tailor our clinical trials to make them easier for people to participate in? These are all questions that can come to bear through observational research. So even if you're not in the trial, it's kind of helping us set up future clinical trials. There are three main types. I promise this is like the only part that's like the class lecture. You don't even have to remember these if you don't want to, but this is how we as a researcher would think of the three different major types of observational research. And they're really defined by time. So cohort studies are when we find people who have a condition and then we follow them forward in time. So for example, the natural history studies you talked about, where we find everyone who has a newly diagnosed tumor, say a plexiform neurofibroma, and over the next 5-10 years, we watch and we see what kind of symptoms develop, how fast does the tumor grow. So finding a group of people who have something and watching them forward in time. There's also something called a case control study. This is kind of the opposite. Here we find people who do or don't have the symptom and then look backwards to see what was different about them. So you'll see this a lot in, for example, cognitive research. So we might say, let's find people with NF1 who do have ADHD and who don't have ADHD, and let's try to see what's different about them. We're going to scan their brains. We're going to see what their MRIs are like. Or maybe for genetics, we're going to look back and do genetic testing to see, did they have different mutations that maybe that's what explains why some group has it and some group doesn't. And then the last type of study we'll talk about is cross-sectional studies. These are snapshots. Both of those other two studies involved kind of looking either forward or backward in time. Cross-sectional studies are just quick snapshots of a population at a time. And so we'll talk about some specific examples in NF of each of these. And I mostly want to set up what's going to happen later in the sessions and in the breakouts, where we'll go really in depth into what specific examples in NF1 and NF2 are. So first, to talk about natural history studies. So you've heard that term already actually a couple of times today in Andrea's talk with the NIH Natural History Study. And I want to say, well, what even is that term, natural history? Really, it's us figuring out what is happening either in the total absence of medication or in people's everyday medications, kind of what's the natural development of the disease. And so these studies often collect a lot of information. Depends on the study what kind of things we're doing, but it could involve often genetic testing, so blood tests, imaging, MRIs following over time, filling out surveys, so us asking you about your pain and your symptoms, and then us collecting all of that information together to really help us understand what is happening in NF, and can we tell people some guidelines, people who come to clinic and have questions that say, I have this kind of tumor, what are the chances I'm going to lose my hearing in the next 5 years? If we have data on hundreds of people about their hearing and how it develops over the first 5 years, we can start to answer that question. We can also use it to help design our clinical trials. So Andrea mentioned, if we know what happens without treatment or with ineffective treatment, then we can say anything different than that is when the drug is working. So that's why this kind of data is so important for us. And Andrea had mentioned this, the NF1 Natural History Study has been going actually since 2008, so many of you in the community might have heard of it. The NIH was actually paying for people to travel there every, I think, 1 to 3 years for 10 years or more, so really such a rich source of data. And because NF1 can cause so many different issues, people were going through a lot of really comprehensive testing. It's a definite time commitment to be in some of these studies, but it also there was such a rich data source for us to be following people and thinking about the development of so many issues. So I just took a couple of papers here that this kind of data helped us figure out what kind of spine issues are people with kids with NF1 having? Can we predict their cognitive development? What kind of hearing issues do they have for people who have plexiform neurofibromas affecting their head and neck? And so this has been a really rich way for us to be able to see kind of how often are these symptoms happening, and is there anything we can do to try to start predicting who is going to develop what complication? Another kind of natural history study you guys might have heard about is being run out of Johns Hopkins and sponsored by NTAP, the Neurofibromatosis Therapeutic Acceleration Program. You can see here, this is one focused on cutaneous neurofibromas, trying to figure out how fast are they growing over time? How many are people getting? And they use this very fancy whole body camera actually to take a single snapshot, and it captures your whole body so that we can look at all of the cutaneous neurofibromas or skin tumors and start to try to figure out what is it that's happening without treatment. Now that we finally have clinical trials that are going to be testing, that are actually already testing drug treatments, and that way we can compare it. This is also an example of a study. I think they're almost done, finished recruiting. I just talked to the PI, Carlos Romo. They have 500 people signed up that they're following once a year for 5 years. So these are really big studies that really involve a lot of the people in the community, but are so valuable to have these big data sets and be able to start to say, in these really big groups of people, how often are things happening? How many new tumors are people growing? And is there any way to predict that? And there will be even more to come in the breakout sessions, because these are in the NF1 and the NF2 schwannomatosis breakout sessions. I won't go into detail, but we can talk more in those about different studies. So Kavita Sarin from Stanford is going to be talking in the NF1 breakout session about the NF genetics cohort, which is another cutaneous neurofibroma focused natural history study. And then I, in the NF2 session, will be talking about the NF2 natural history study at the NIH, which is currently run by Dr. Chittaboina, who's a neurosurgeon at the NIH. And then also our work on schwannomatosis-related pain by my mentor, Dr. Plotkin at MGH. So in the breakouts, we can go into these in more details. The second kind of study I wanted to set up, I mentioned case control studies, and here's an example of how it really is informing our work looking for genetic biomarkers in NF1. So this is work from Dr. Sunby and his colleagues at NIH, and you can see here on the left what is the case control. They took blood and tumor samples from healthy volunteers, so people who didn't have any kind of NF1 related tumor, people who had plexiform neurofibromas, and people who had MPNSTs. And based on that, the data they got from the blood, they did the complex parts of the DNA analysis are even too complicated for me, but let's say they broke down the DNA. They looked for genetic signatures, fingerprints that could tell us what's the difference between having a plexiform neurofibroma or neurotumor and what's an MPNST, and comparing that to people's actual MRIs and clinical exams over time to see, is there a way that we can use this data, this blood sample, to predict whether or not your tumor is a plexiform neurofibroma or an MPNST. And the reason that's important is because it's not always obvious on an MRI which of those two tumors you have, one of which is benign and one is malignant. So we need to treat them differently, but we can't always tell just from looking at MRI. And so this was a way for us to use this case control design, comparing the genetics and the signatures in people's blood to try and predict that. And this is something that actually has had amazing strides happening already, and there's a large study that's recruiting to confirm this, but they have basically, this is maybe too complicated of a slide, which I apologize for, but have basically are proposing that we can hopefully validate this and move this into everyday clinical practice. So we can have what's called a liquid biopsy, a blood test that is going to tell us whether you have these tumors and whether they're becoming malignant. And that way we can have hopefully an earlier signal that says, oh, this is on the pathway to becoming malignant, we should take it out now. Right? Rather than waiting for someone to be diagnosed with cancer, trying to figure it out earlier in a non-invasive, easy-to-use way. So really exciting work that I think is going to be translated to the clinic pretty quickly. And I wanted to give one shout out, you can't see it, that I think Jenny Garzon, who's going to be talking in the NF1 breakout, is also going to be talking not exactly about this study, but also about genetic biomarkers in NF1 and this kind of research if you have more questions. And then the last type of information I wanted to talk about is kind of the research I do the most of, which is surveys, interviews, this cross-sectional snapshots of asking people what is happening. And it's really, this kind of research is so important, I mean, just in general for us to understand your experiences, but even for drug development. These are really great ways, doing these surveys, doing these interviews is a great way for us to tell researchers, pharmaceutical companies, people like the FDA who make decisions about what drugs to approve, to really understand what patients' journey is. What are people's needs? What are the symptoms that are causing the most issues? What are the problems with current treatment? They can also help us figure out how are we going to measure those symptoms in a clinical trial? How are we going to know if these outcomes that we're seeing are meaningful? To the point that Andrea had made in her talk, the FDA said it's great that you're shrinking tumors, but is it actually changing people's symptoms? Is it benefiting them? And the easiest way for us to tell that is by surveying the people taking the drug or interviewing them and asking, is this really happening? And so that can really fit into this way of showing the value of these treatments and trying to think about this from a really holistic point of view, not just measuring one tumor's volume or a hearing test number, but also trying to think about what matters to you guys. So some examples of this research recently, for example, sometimes we have what I'm calling descriptive surveys, questionnaires, they all mean the same thing. This was one that we did as part of the RAINS consortium Andrea mentioned, and it was a survey about what are people's with NF, all types of NF and schwannomatosis, what do they think about psychosocial trials, psychosocial treatments? What are they interested in? And I was really impressed. This survey was completed by 630 people, which is pretty big for our NF community. And we found, the 68, so 2/3 of people probably wanted to participate in a psychosocial trial if it targeted a concern. And here's the top list. We said, well, what concerns do you want? What should we be focusing on? You could see here anxiety and healthier lifestyle and coping with daily stress were the highest rated things. So this tells us as researchers, hey, this is what people want and we should be focusing on this. And so this is really helpful. Another term I wanted to talk about in relation to surveys and questionnaires, you might hear the phrase patient-reported outcome. That's really just when a survey or questionnaire is being used as an outcome in a clinical trial. So it's the same, it's just another fancy word for survey. If you hear it, that's what we're asking you to do. But it can provide really important information about the effects of medication. So this is a little bit older, but was from a study, a clinical trial of bevacizumab in people with NF2. And we already in that trial could measure people's tumor size to know if it was shrinking their tumor. We could send them right to the audiologist to get a formal test of their hearing. But something like tinnitus, which is the ringing in your ears, how would we know if that changed? The only way you can do that is by asking patients, how is your tinnitus? How bad is it? Is it interfering with your life? And this is a measure, so the TRQ is just the name of the patient-reported outcome survey, and we could see during treatment, the high scores mean you had worse tinnitus, the low scores at the bottom mean you had better tinnitus, and that during treatment, most people's, not everybody's, but almost everybody's score went down and their tinnitus got better. And then after treatment was stopped, for the most part, it didn't go right back up. And so this is the kind of information that we're actually looking at when you fill out these surveys to make these scores and see, is this new treatment actually having a difference? And it's especially important for things like pain, tinnitus, these things that we have no way to objectively measure. We need you guys to tell us if it's getting better or not. And this is exactly the kind of data we would bring to the FDA to show them that there is benefit. And then the last kind of survey I wanted to set up, because I think Miranda might be mentioning it in her talk, is you might hear the word patient preference surveys. It's just another bucket of kind of types of surveys where we force people to make choices. We say, would you want option A or option B? Or can you rank these options in order of preference? Can you assign points to like which one is better? There's various ways to do it. But it's a way by forcing people to pick between options over and over again in different configurations, we can start to see what is it that's driving people's decisions and what matters. So for an example, this might be one type of survey you would see where there'd be 3 different options. No treatment, drug A, drug B. And they'll give you some information about those drugs. So this drug has this risk of stroke, that one has less. But maybe it requires more healthcare visits or it costs more. So this is how we can do these surveys. We can figure out what are the trade-offs people are willing to make, what are the risks and benefits that they're weighing, and what are the costs and benefits so that we can target our treatments hopefully appropriately. And I know that this is kind of how it's set up in the gene therapy survey. So there was in everybody's folder a little sign if you're interested in taking a survey like this so that we can figure out what are the appropriate risks and benefit trade-offs of gene therapy, please do so. And I think Miranda will talk about this after lunch. And then the last type of research I wanted to talk about, because it's my favorite, is qualitative research. So quantitative research is everything with numbers. How big is your tumor? Or even what's your score on that tinnitus measure? It was a 0 to 100 scale. That's all quantitative. Qualitative is everything else, everything with words and text and images. Things like interviews or focus groups or surveys where we have open-ended questions where we ask you to write out a sentence or two about what's happening. There's also other ways, like looking at existing documents. There's really cool research where we look at people's posts on Twitter and Facebook and Reddit, what questions they're asking. So, right, all of this rich written data and spoken audio that we can get from people to talk at length about what is interesting to them. And there's a lot that we'll talk about in the NF2 schwannomatosis breakout session about how these kinds of interviews can inform clinical trials and help us design them. But to show that there's some of this research that's not just related to trials, this is actually from my own PhD dissertation. And I interviewed people with non-NF2 related schwannomatosis about what was it like when you got diagnosed? What went wrong? Which was unfortunately for a lot of people. They had delays, their providers didn't know, and what do you wish had happened? And we used that information from talking to 18 people from across the country about what it had been like to try and give guidance to providers to say, if you're going to diagnose someone with schwannomatosis, this is what you really need to be thinking about. These are the things that you're going to need to educate them about. This is the stuff, the issues that they've probably experienced and the things they might need some psychological support to help with coping, and how we can develop this, what we call therapeutic alliance, this sense of collaboration and trust so that you guys can work together really effectively. And so by really listening to patients' stories about what had happened, we were able to kind of turn that into guidance from future providers about here's what hasn't been maybe happening so great and how we can try to make it better for future patients. And I'm almost done here. This is the last quote I wanted to say. This is actually from one of my own interviews. And it was about a different topic, but I think it really speaks to why is it important to participate in observational research. This was someone who had NF2-related schwannomatosis, and they said, I've said that my chief criticism of doctor, the name is redacted, is that he treats me like a pile of symptoms and not a person, which can be really, really frustrating. I'm pleased that you're doing this additional qualitative research. I think there's a lot more to be understood about NF from a great deal of perspectives that aren't currently in the medical literature. And the reason I like this quote is because there are a lot of things that probably seem obvious to you as the people living with NF day to day and going through this that are not obvious to us as researchers or clinicians, that aren't unfortunately represented in the literature. And I think especially by these surveys and interviews, getting to hear directly from you about what things are like and what we could work on is so important to raise that awareness in the community. So I hope that you will consider the next time people approach you for these to know that we really do care about your answers. It's been so enlightening, even to me as someone who's been in NF research for 14 years already. I still learn new things that I didn't know about. And so that's why some of this observational research is so important. Not only because it can set up our clinical trials and help us design them, but also because it really helps educate future generations of students and researchers and clinicians about what's going on and what matters. So I'll take any questions if anyone has it on that research, and hopefully we can dive deep into some of these topics in the breakouts to come as well.
Thank you. You have a question here.
I'm so annoying. I am wondering how the information that is collected, I obviously through journals, et cetera, but why is it that there are still so many doctors who are uninformed? And how is your data disseminated across the community nationwide? Why do we all have to move to get appropriate care?
Yeah, unfortunately, that is such a challenge with rare disease research, especially even though we publish in journals for medical providers and try to go to conferences to talk about that. If you think about the average, for example, primary care doctor, they maybe have one person with NF in their practice, and they're trying to keep up with all of this. So I think we have to do better about dissemination. There's actually a whole new field of research called implementation science that's really focused on this. It's great for us to come up with new ideas, but how do we get them into everyday practice? What are the methods? One project that I'm actually working on right now that I'm really excited about is we're trying to actually do this with people as primary care providers. Keep an eye out in the next 3 to 4 months. We're going to be recruiting, and we're going to actually be sending letters to both patients and their primary care doctors to tell them, hey, you might not know, but there's actually NF1 clinical care guidelines that are published by the American Academy of Pediatrics, the American College of Medical Genomics. And here are, they apply to your patient, and we just wanted to make you aware. And so I think we have to do more of that proactive reaching out as well. But of course, that still doesn't replace, the specialists who do this day to day. But I think that is definitely something we have to tackle beyond just the standard journals and websites and things which rely on the doctors to come find it. We have to be actively also pushing it out to them. So I'm really hopeful that this new trial, please keep an eye out. We'll advertise it through NF Midwest and on the NF registry. We're hopeful that this could be a good model to send information directly to people's physicians about NF and try to, get them up to speed.
And we do have those care guidelines out there, by the way. If
Oh yeah, I
somebody's-
think
they're-
the actual
I think
guidelines, if you want to see
they're
them, are out there as well.
Is there another question?
Question. I just wanted to add quickly to that. There's also a big push in the NF community all the way around to make the scientific information more manageable for patients to understand, get it into lay language, and particularly with AI now, AI is not perfect. So we're trying to use AI in the right way so that we can communicate with patients, because patients, as most of you know, a lot of times you're the more knowledgeable one in the room about NF. And so if you can understand it enough to send your provider to the right place, it can help. And so we know that not everybody can travel to an NF clinic. So hopefully getting some of that information disseminated into patient hands in an understandable way might help in the future.
Well, this is probably a good point to say that when you're participating in research, there's other ways. Like you didn't talk about RAINS.
Yeah.
But RAINS, Miranda and I and Steve and I think Natalie, we're all on RAINS, and we're on a committee with the lay for RAINS trying to summarize stuff. And you really need people involved in that. We need patients and parents, caregivers involved in RAINS, in other panels, in any way that they can give their input and direct some of these things. So there's a brochure out there about RAINS, by the way.
Yeah, because I talked mostly here about what is it like to be a participant in the research, and things like the RAINS Consortium, which you've heard mentioned, are actually kind of different. It's not that you're the participant in the research, it's actually that you're a participant on the research team.
Right.
You're working in partnership with us, the researchers and the clinicians, to help design studies, to give input on what we should measure or how to measure it. And so that's something that's also a really important way you can contribute to research, even if you're not, say, eligible to receive a certain medication or be in a study, that we still need people to help us ask the right questions and interpret that data. So it's been a really growing part of our NF research community, I think, and is being more and more embraced to have people kind of be partners on the team, if that's something that interests you.
And we need people like that working with the NF organizations too
Yeah.
to help us do our programming. All right, so